Moving on, the Indian Council of Medical Research, the ICMR, has detected 2 cases of human metapneumovirus, HMPV, in Karnataka. Both cases were identified through routine surveillance for multiple respiratory viral pathogens as part of ICMR's ongoing efforts to monitor respiratory illnesses across the country. However, there is no clear information whether the Chinese type of the HMPV virus and the virus found in the child are the same, according to the Karnataka Health Department. As per reports, child and parents have no China travel history per se. Now, the first case is a 3-month-old female infant who was diagnosed with HMPV after being admitted to Baptist Hospital in Bengaluru with a history of bronchopneumonia. She has been since discharged. The second case is an 8-month-old male infant who tested positive for HMPV on the 3rd of January 2025 after being admitted to Baptist Hospital, Bengaluru with a history of bronchopneumonia. The infant is now recovering. But again, it's important to know that neither of the affected patients have any history of international travel. Now, the Health Minister of the state of Karnataka, Dinesh Gundu Rao, has called an emergency meet with health officials to discuss the precautionary measures that are set to be taken up and advisories that are going to be put forth for the common man out there. Health Department, it had made it quite clear earlier that the HMPV virus is already present in India, but what is unclear is that the HMPV virus that is currently causing concern in China, is it the same virus that's present in India or not? But the rapid spread of HMPV virus cases in China and beyond have resulted in a pandemic scare across the world, including India. The virus is being compared to COVID-19, which also began in China 5 years ago. The symptoms of HMPV include cough, fever, nasal congestion, and wheezing. Severe cases can result in bronchitis and pneumonia. Currently, no vaccine or effective medication is out there to tackle the HMPV virus. And here's a lot at how the virus spreads. An enveloped single-stranded negative sense RNA virus. It was first discovered in 2001. It spreads through close contact with infected individuals via respiratory secretions or by touching contaminated surfaces. Children, the elderly, and those with a compromised immune system are particularly vulnerable. And amid the pandemic scare, a list of do's and don'ts has been released by the Karnataka government, just like several other state governments, to ensure safety of the state residents. Meanwhile, Delhi health authorities have issued an advisory to ensure preparedness for potential health challenges related to the HMPV and other respiratory viruses. Delhi's Health Minister, Saurabh Bhardwaj, he said that all hospitals should be completely prepared to handle any potential increase in the respiratory illness. Kerala Health Minister Veena George has said that they are carefully assessing reports of global viral fever and respiratory infections. While there is no need for panic, the Health Minister of Kerala, to be precise, recommended that pregnant women, the elderly, and those with serious illnesses must wear masks as a precaution.
1% of the illnesses normally are due to this HMPV virus. So it's a very normal thing, and it is not there's no fatalities in this, and people get it, and they are affected for a few days, and it passes on. So that is what is this HMPV that has been detected even in Bangalore Baptist Hospital. It's the same thing. So there's nothing new, nothing to panic, nothing to worry. That is the first point. Second point is that whatever in the future, what they're talking about in China and all those things are right now not connected to what is there over here. Government of India is monitoring it, and if any such further information is there, then we will come to know, then we will decide what to do. Right now, there's no surge of cases. Even Government of India is saying no surge of cases of ILI across the country, no sudden spurt of cases or pockets where suddenly this is increasing, or no serious situation has emerged anywhere in the country. So I think people should not panic, just be normal. We are also looking at it, monitoring it, but right now there's nothing to worry.
Sir, any guidelines you are going to issue?
Guidelines are regular guidelines which are good for normal course, because now winter is there, so illnesses can increase, especially cold, cough, and these viral infections can increase. So better to be careful, avoid crowded places, keep your hands clean, and eat hygienic food, drink water, all those things are regular. So no special guidelines concerning specifically for this HMP.
2 मास का बच्चा जो डूंगरपुर राजस्थान से आया था सारवार के लिए, उसमें ये डिटेक्ट हुआ है और उसको सारवार के अर्थे अहमदाबाद भेजा गया है। कोविड के टाइम पे भी जो डूज एंड डोंट्स जो दिए गए थे उस हिसाब से ये संक्रमण जो फैलता है तो वो ऐसे छींकने से या हवा से, फिर बहुत सारे हाथ धोना है, किसी के संपर्क में जिसको भी हुआ है तो उससे नहीं आना है, वगैरह वगैरह जो भी है वो हमें उसका पालन करना है। एसओपीज और जो गाइडलाइन है क्या क्या करना है क्या क्या नहीं करना है वो राज्य सरकार की ओर से ये एसओपी भी जारी होगी, शायद आज ही हो जाएगी।
And he took up a meeting with the department, and whatever decision he takes, the government will implement it, and the government will take all precautionary measures to implement and to prevent the disease.
5 years after the COVID-19 pandemic, China is witnessing an outbreak of the Human Metapneumovirus, HMPV. How worried should Indians be? Let's find out. The Indian Council of Medical Research, or the ICMR, has detected 2 HMPV cases in Karnataka. These are the first 2 cases diagnosed in India. Both these cases were identified through routine surveillance for multiple respiratory viral pathogens as part of ICMR's ongoing efforts to monitor respiratory illnesses across the country. Both the 2 patients were young children. An 8-month-old male infant tested positive on January 3rd, 2025 after being admitted to Baptist Hospital, Bengaluru with a history of bronchopneumonia. The infant is now recovering. The other patient was also a 3-year-old child with a history of bronchopneumonia who has since recovered and has been discharged. So, who is vulnerable to HMPV? Young children, especially those under 5 years old or older adults, anybody with weakened immune systems, those particularly vulnerable with chronic lung or heart conditions. What are the symptoms of HMPV? Here are the warning signs to go see a doctor. If you experience difficulty in breathing, fast breathing, wheezing, high fever or dehydration, another warning sign is a blue or grey tint around the lips or the fingernails. What are the precautions against HMPV? Wash your hands frequently with soap and water for at least 20 seconds. Cover your cough and sneezes with a tissue or your elbow. Avoid close contact with people who are sick. Clean and disinfect frequently touched surfaces. Remember, HMPV is a common virus that causes respiratory illness, so there's no need to panic. Most people recover with rest and supportive care. If you have concerns about your health or your child's health, contact your healthcare provider. Well, there's no need to panic, but of course, keep in mind all the advisories that are being put forth by the center and the state governments.